Hello, my name is Haley Lopez. I am a student at Harmony Science Academy. This is my partner, Daniel Rodriguez, and he's going to be assisting and showing us the visual of our PBL project in suturing. As we start, we need to do preparation beforehand, which is clean the wound and wash our hands. He immediately goes into the needle insertion, which he holds the needle driver, grabs 2/3 from the tip, inserts the needle at a 90 degree, and then enters the skin about 0.5 centimeters from the wound edge. Pass needle through dermis, which is aimed for symmetrical depth and distance on both sides, and then he exits on the opposite side, mirror to the entry point for proper alignment. He then pulls the tie all the way in, and then he pulls suture through, leaving the tail about 2 to 3 centimeters long. Tie or squat knot, first throw with 2 wraps, then secure with 3 to 4 throws, ensures knot stability. And that's where he cuts the suture ends. And then this only repeats afterwards. You place additional sutures about 0.5 to 1 centimeter apart, depending on the wound length. Check wound edge approximation, meaning ensure skin edges are aligned without tension. Then he avoids tightening too much to prevent any scarring or ischemia, which would basically cause the wrong type of healing for the person. As he continues to repeat the same step, which is the needle insertion, he continues to exit on the opposite side of the skin, causing this zigzag motion going throughout. As we watch Daniel continue to show our experiment, we're going to be talking about the social studies, or the SS component of suturing. In suturing lessons, students explore the history of cultural context of wound closure and techniques, tracing practices from Asian civilizations that use linen, silk, or even mandibles to modern sterile sutures. The historical lens highlight how medical innovation is shaped by cultural needs and available resources. Students also examine the ethical dimensions in the workplace by surgical care, discussing questions of access, equity, and public health, such as how a workplace safety laws reduce injuries requiring sutures. By situating suturing with the broader social and historical framework, learners connect clinical skills to the evolution of medicine and the societal structures that influence healthcare delivery. Now we're going to be talking about the ELA components, and this is a quick summary overview how it also strengthens communication and literacy skills by requiring students to document the procedure in precise technical writing. This meaning that they have to write down every step and every action they take during the process, using correct medical terminology and clear sequencing. Throughout the role play, students practice dialogue with patients, explaining the suturing process in an empathetic, accessible language that builds trust with the patient. Reading short case studies or medical text enhances comprehension, while reflective writing tasks encourage students to analyze how teamwork and communication impacts their performance.